Hi, I am Dr. Vivek Gupta. I'm a practicing orthopedic surgeon with more than 20 years of my private practice. I've had a very active life in the past, but due to some financial constraints and some financial losses due to my own mistakes, I had gone into a phase where I was not able to take care of myself and I had put on a lot of weight. I had been obese from my childhood, but because of my exercise and everything, I used to stay fit. And after that, the weight started increasing, and which was absolutely uncontrollable, and I went up to about 130 kgs plus. My blood investigations, my lipid was absolutely haywire, my cholesterol, triglycerides was beyond imaginable. My HbA1c was 12.5, my BP was about 210 and 140. And in reality, if I tell you, if I used to go back to sleep at night, I used to be so afraid that I am not sure that I'll be able to get up in the morning because I might be able to have a silent MI, which is a very normal thing in diabetics. So I had to take a call what to do about my life. Do I keep doing the way the life is going on? And you'll be surprised that before I took a decision what I need to do in my life, that time I used to do a lot of exercise. That means I used to do about 50 minutes of treadmill, about half an hour to 40 minutes of my gym, which includes cardio and everything. But nothing was happening. There was not even a single kg loss. I even joined a weight loss program with BLCC, where I just lost money. Absolutely nothing I gained out of it, and it was just loss of money. Then I tried to find out what should be the best for me, where I can have my good practice, and what I should be able to do about my life. Because the age was increasing, I was about 45 at that time, and I had a small daughter. So I thought, what is the best call which I should be able to live life. Then I talked to my physician and my endocrinologist, and when they saw my reports, they were absolutely shocked that being a doctor, how can I be so careless? How can all my reports be so haywire? And my lipids are gone, my HbA1c was uncontrolled, I was on insulin, I was taking my anti-diabetics, I was taking my anti-hypertensives and anti-dyslipidemia medicines, but nothing was happening. Then I found out about Dr. Atul Peters, who's a master bariatric surgeon, as far as I can tell now. And being a doctor, one thing I would like to tell you is that a doctor is the worst patient, because he knows all the complications about surgery, about what can happen, what can go wrong, what can be good, what can be bad. But now I can tell you, because I being a surgeon myself, I always believe that if I'm going for any procedure, any surgery, a patient has to have full dedicated faith in his surgeon, which I totally believe in, and it's not that I always preach it, I always follow it. So I came and met Dr. Atul Peters, and he is an absolute gentleman. He attended me so nicely, being a colleague, as a doctor friend, and I felt just like at home. I never felt that I'm coming to any surgeon who is going to treat me like a patient. He explained everything, what I really need, what surgery is best for me, what I should be going on. And I felt so at home that it just took me about 10 minutes to think that this is what I need. And in fact, you'll be shocked that I never told my family about it, that I'm going to think about this procedure. So I had about half an hour meeting with Dr. Atul, and I understood all the procedures, what are the pros and cons of the procedures, and finally I let everything to him. And I told him what is best for me should be done. So there was no ifs and buts, there was no confusion in my mind of what surgery is going to be done is good for me or bad for me, because I totally believed in Dr. Atul Peters, and I let him do what I did. So I took an immediate appointment. When it was not to be done, he said, when should I get my investigations? I said, immediately. Why should we wait when we need to get it done? So it's almost 6 years now since I've got my bariatric surgery done from him. and the journey in the last 6 years is absolutely fantastic. I had a very nice surgery done, which was my gastric bypass. In fact, I had my laparoscopic cholecystectomy along with it. So Dr. Atul Peters did both the things for me at one go. Second day I was discharged from the hospital. I was on my anti-diabetics for about a month or so. And the best part is, I used to feel a bit hitch that should I be calling Dr. Atul Peters or not. And I was on the WhatsApp group with them. I used to send them my blood sugar levels, and I used to get back how much insulin or whatever medicine I need to take. But in 10 days, when I didn't contact Dr. Atul Peters, I was in fact, I got a firing from him that why I'm not in touch with him. So being such a senior surgeon and being in touch with the patient and his availability is the main thing, which I used to feel that I practice in my own practice. But after finding and meeting Dr. Atul Peters, hats off to him. He was available to me 24 hours, 365 days a year, and I had a very smooth sailing. All my antidiabetics went off. I was not on any hypertensives, no dyslipidemia medicines. My blood investigation started improving. I lost considerable amount and I came down to 89 kgs. It's been almost 6 years now, and I've had a comfortable life. In fact, energy levels are much more. My practice as in my personal life, my social life has improved. My patients, because I have been practicing 20 years, people come to me and tell me that, are you the younger brother of Dr. Vivek Gupta? Because they take my appointment, when they see me, they say, no, we have come to show Dr. Vivek and not his younger brother or junior. And when you listen to my voice, because the voice doesn't change, so they accept, okay, I'm Dr. Vivek, and then they feel comfortable. So it's been a really nice journey. I'm very thankful. I'm so happy that I've got a new leash of life, and all thanks to Dr. Atul Peters for giving me this new lease of life. I'm very happy with my family, and my social and personal life. My professional life has a great gain after that. Because I look smart now, people feel more confidence. I used to feel there used to be a bit of portion in my life where I used to feel telling a patient about surgery, I used to think, what are they thinking? Doctor himself is so obese. How can he teach something good when he himself doesn't take care of his life? Since the time I've lost weight, the way I speak to the patient, the confidence I've gained is exponential. I can't explain in words the good feeling I have about this surgery. And since the time I've got these surgeries, a lot of my own patients have got bariatric surgery done from Atul Peters, and they are absolutely happy. And given a choice, now a lot of people have started getting surgeries done from people here and there. But my personal choice is, if a person really wants a dedicated team, bariatric team, and hats off to the team of Dr. Atul Peters, where they have a qualified nutritionist and the whole team which looks after you so well. And even after 6 years, I am so shocked that they follow you with every year that have you got investigations done, are you taking nutrition supplements or not. Whereas it's practically impossible to keep a track with such a busy schedule of Dr. Atul Peters. He still follows the patients and advises what you need to take. So I think that's from my side. And people who require bariatric surgery, I think this is the place to come. And just believe in him and get it done what he says. Last advice is, just believe in him and ask him what is best for you, and not what you have heard or what you have Googled. Google cannot tell you what is best for you. The doctor, ultimately it's the doctor who tells you what is best for you, and you have to have faith in him. That's it from my side. Signing off. Thanks, Dr. Vivek.